Recently, a patient from Manitoba billed the government for about $14,000 for his private surgery that he received in Lithuania. And he did it as somewhat of a tongue-in-cheek exercise, but also making a really important point at the time. And so today I'm excited to have a chance to chat with Max Johnson about his bill and just sort of how the whole thing went down. So thanks for taking a few minutes to chat with me, Max.
Oh, it's a pleasure.
So why don't we start at the very beginning? You live and work in Winnipeg and you ran into some knee problems. Is that correct?
That's exactly right. Like as with thousands of other people, as we grow old, arthritis hits and hips and knees start suffering.
And so you ran into problems, and then what was it that what was the reaction when you went to the healthcare system? They diagnosed you had a knee problem, you needed some replacement surgery. How long are you looking at in terms of a waiting period there?
Well, it's difficult to know. When I was first diagnosed, I was told that it would be up to 8 months before I had a consultation with the surgeon, and then a further 18 months before I would have surgery. As it turned out, I had a consultation within about 4 or 5 months. And then the wait was simply indefinite. We were starting at the beginning of COVID, of course, which exacerbated a lot of these waiting lists. But the waiting lists, even 2 years ago, were getting up to 2 years, even now 3. So the pain, unfortunately, in any sort of arthritic condition doesn't get better. It just continuously gets worse. So I decided it was really an opportunity that I really should go and have a look at alternatives to waiting.
And what was the impact on your day-to-day life with the pain and how it affected your family, your work life, all that?
Well, it's difficult really to say. I couldn't work because the type of work that I do requires me to be in very unorthodox and peculiar places, leaping in and out of canoes and working in the high Arctic and stuff. It's just, you can't do that if you can't walk properly. It's just as simple as that. The pain with walking was bad, climbing stairs was extremely difficult. And it just got to be increasingly painful and difficult to do anything on a daily basis. But I should add, I'd actually had a hip replaced 3 years ago, where I'd also given up on the health service and went to Montreal and had it done privately at that time. And it's very difficult because with hip surgery and knee surgery, you get to a point that you really can't move. Moving is exquisitely painful. And you're just sitting there and they say now 2 years. At the end of 2 years, I would have been in a wheelchair. So at some juncture, you end up taking these matters into your own hand and getting it done privately.
And so were they prescribing painkillers at the same time?
They were, but I'm a little cautious. I don't mind taking painkillers if it's going to simply get rid of the pain. But what really I found most disquieting about it was the indefinite nature of the whole thing. You know, it's called a waiting list, but it's not a waiting list. If you were on a waiting list, you'd actually have a date. You might not like it, and the date might be in 2023.
Yeah.
But in reality, this is much more akin to being stuffed into a corral like a sheep waiting to be dipped. And there are thousands of people jostling for position in this particular room, but you have no idea when you're going to be there. And it just goes out indefinitely. And I really didn't want to be on an indefinite diet of opiates. And I certainly didn't want to be economically inactive for another 2 years.
I certainly don't blame you. And that I think is one concern that we often don't hear about with government waiting lists. And when I say we don't hear about it, governments don't talk about this, or the side effects from these long waiting lists when you have patients being prescribed painkillers for long, long periods of time. You can end up with all kinds of other health problems as a result. And I mean, that's a whole other story, but I can understand why you wouldn't want to be sitting on the sidelines and doing,
it's not really another story. It's an integral part of the same story. You're prescribing people painkillers, and some people will get addicted to them, and that creates an enormous problem. But not only that, whenever you're dealing with a hip or a joint issue, you learn how to compensate and you learn how to walk. And that in turn starts creating many other problems with other joints. And after 2 or 3 years, what started off as one knee are now a couple of ankles and a hip.
Mm-hmm.
So it completely exacerbate the medical problems, let alone the financial and personal problems.
Mm-hmm. No, I agree. I was just meaning it's a whole problem that I don't think has been analyzed enough. And I'm interested in delving it a little bit deeper into your decision to go abroad and what that experience was like. And like I say, to also chat about sort of your response to the government when it was all said and done. So can I ask you ended up deciding to go to Lithuania for your knee surgery. How did you end up deciding on Lithuania?
Well, to be truthful, they decided for me. The clinic, the Nord Orthopedic Clinic in Kaunas, Lithuania, is probably, or has probably the best search engine optimization in the world. Oh, wow. When I started looking, my first inclination was to go back to Montreal because I went to the Duval Clinic once and they were fantastic. And they indeed could do it. I could get it done in Calgary. And as I just started looking on the internet for knee replacements in Canada, then in addition to the Canadian options, the Nord Clinic found me and started chasing me around.
Oh, really?
And their clinic in front of me every time I went on my phone and on a computer. And so, of course, I ended up looking at their facilities. And they also have an extremely active patient support group site on Facebook, which sounded to a point almost like a cult, with these people saying, how wonderful it was and brilliant it was and terrific it was. But after a while, you sort of put them all together and realize that the facility in Lithuania is really first class. Then, of course, there's the financial myself and having to pay for it by myself. The operation alone in Canada would have been a little under, or say, around $30,000. Going south, it would have been about 60,000, and that's just for the operation. Lithuania was 15,000 for the operation and 2 weeks inpatient therapy at a spa with massage, with physiotherapy twice a day, cold treatment, heat treatment, and 2 weeks of that was an absolute godsend. So it really didn't take much in the end when I was comparing all of the options to say, well, Lithuania, once you get on a plane, does it really matter how far you go?
Yeah.
And their proposition was just fantastic. And then added to it, I mean, there are also opportunities in Mexico and Cuba and all sorts of places, but because Lithuania is a member of the European Union, you realize that any of their medical facilities operate under the sort of umbrella standards of the EU, which certainly made me feel pretty good about it.
Oh, good. And when you say about 15,000, does that include the other costs such as airfare, complications? Not okay.
I happen to have sufficient airplane points, so the airfare wasn't really an issue for me.
Okay.
But it covered really from the moment that I arrived in Vilnius, and they meet you at the airport, take you to the clinic, do their thing, you get blood tests and x-rays and heaven knows what, and then transfer to the rehab facility, which is about 2 hours away. And then at the end of that, they take you back to the airport and wave goodbye. So everything from arrival to departure was just under 15,000.
And when you were doing this, going through that whole exercise of looking at prices and options abroad, was part of you annoyed that, in Canada, we pay a lot in taxes, whether it's through sales taxes or income taxes or all the other different taxes that we have to pay. We have a high tax burden. So often people say, yeah, but we're not like the US. You've got access to, full healthcare system. And yet the system wasn't there for you because you decided that you would need to go abroad to receive that service in a timely manner. So were you kind of annoyed at all that, you're paying for something you didn't get?
No, I'm more than annoyed. I'm absolutely furious. I think that the government, we have a single pay insurance system in the country, and I believe in that 100%. But because governments in Canada are unique in the fact that they are also the single provider, that for governments to maintain the sort of philosophical high ground of saying, well, we have a national health system, while at the same time, individual, provincial, territorial governments chip away at the delivery, yet offer no alternative. That I find an absolutely preposterous situation. And yeah, I was extremely annoyed. You don't expect to rock on up and have it the next day, but when these waiting lists are 2 years and 3 years and people just go, well, that's what it is. No, it's a system that is simply broken. No other way to look at it.
I think we've got a system that in many cases it doesn't make sense. I mean, you mentioned that you could have gone to Calgary for the procedure. Is that correct?
Yeah.
And I've heard Dr. Brian Day, he's involved in a court challenge with the BC government in particular about a private clinic he operates in BC. And he's made the point that in BC, they're completely allowed to operate on patients from outside of BC. In Alberta, you can operate on patients outside of Alberta. So you get people from the two provinces doing this. It doesn't seem to make any sense, especially if you think about it from an environmental angle, that you're causing people to needlessly get into airplanes and fly to other jurisdictions. You end up with additional emissions, which is something obviously governments have said that they're trying to cut back on. But I want to ask you, when you were in Lithuania, were there any other Canadians there that you saw or talked to at that?
Yeah, there was a chap from Calgary when I arrived. And in the last days, just before I left, another Albertan showed up and somebody from Saskatchewan. So with me from Manitoba, that's 4 Canadians in a 2-week period, which is actually pretty remarkable for where it is.
Yeah, and I certainly think about the economic angle of everyone, showing up and spending thousands of dollars. And I don't begrudge anyone for doing this, because people are trying to ultimately just try and improve their health, which I completely understand. But when governments don't allow people to spend those dollars in their home country, you end up with economic leakage, don't you?
Well, you end up with economic leakage. But another side that also governments very, very rarely, if ever, talk about is the fact that now I've had the operation. In the next 12 months, let alone 2 years, I will pay more income tax to the government than it cost me to have the surgery. Which, if they wanted me just to sit on the sidelines and be a cripple, I wouldn't be putting anything into their pockets.
Yeah.
So I am going to put more into the government's pockets than it will have cost me, simply by being allowed to get back to work.
And I think that's part of the sort of holistic examination that governments don't consider often enough, is that, like you say, if you're sitting on the sidelines waiting for a year, 2 years, or whatever it is, because you can't work, then you're not earning extra money, you're not paying extra taxes, so it costs the government that way. But and then to the other point that we talked about, if you were sitting on the sidelines for a year or two and you're popping painkillers the whole time, and then it causes, say, liver damage or some kind of other problems to your body, then the government has additional costs in the healthcare system. So I think just the whole system, it doesn't really seem to make a lot of sense. We're trying to do our part as an organization to look at different alternatives for solutions, but it is interesting that there's all these other Canadians there.
It's a crazy situation. It appears to be purely cost driven. Here is our budget. Our budget will allow us to do X number of surgeries during the year. None of the other points that you just mentioned are included in the equation. Even if they outweigh the cost of surgery, it becomes relevant in government accounting. And to make people sicker, to make people poorer, and to withhold its own tax revenue for the sake of holding to a single numerical target, I don't think you get past economics 101 with a life approach to that. I mean, it's just reprehensible, really. We're going to make people sick. Just sit there and wait until your turn to chip away at the budget comes along. We had several years ago in Manitoba, the flood of the century. Now we probably have more of them coming up, but the government's answer to the flood of the century was to spend a large amount of money on expanding the floodway around that protects the city of Winnipeg,
Mhm.
building massive dikes, building massive culverts, and building a protection system for the city of Winnipeg that should see us through for the next 20, 30, 40 years.
Mhm.
The result and the government reaction to crisis was activity.
Mhm.
This is a crisis.
Mhm.
We have 130,000 people on various waiting lists in Manitoba.
Mhm.
Every province has the same problems. And we know that those problems, yes, they've been exacerbated by COVID, but those problems come because governments have withheld taxation and have withheld government expenditure on a fundamental part of life
Mhm.
in this country. And unless they come back and they really spend significant resources, we're going to remain in this position. France, some 20 years ago, had very similar things. They had years and years of waiting lists for hips and knees and heaven knows what.
Mhm.
And the government just took a deep breath and said, well, there's only one way out of it. We're just going to have to get rid of these waiting lists and start again and ensure that we never get back to that position. And that's exactly what they did.
Mm.
Took them a couple of years, and elements like going to Lithuania, allowing some people the flexibility and the latitude
Mhm.
to take health into their own hands, compensate them for what it would have cost at home. I'm not suggesting anybody can go silly and spend endless amounts of money.
Yeah.
But there are 8,000 people needing hips and knees in Manitoba alone. 8,000 people. There's a capacity to do 3,000 a year. The list grows by 2,000 people a year. You can do the maths.
Oh,
Something's got to give. And if, a couple hundred people go to Lithuania and the 500 people come to Calgary, and just get the waiting lists out,
yeah.
clear them up, and then decide how it's going to be financed in the future.
It's a huge, massive problem that cannot be talked about enough. And I think one mistake that some people make on this issue is they say, oh, it's because of COVID. Before COVID, waiting lists were at record levels. They were right as high as they've ever been. And that was going into the pandemic. And the other issue that we have as a nation is because we just have the one system for most services, we don't allow this supplementary system. Our supplementary healthcare system is the United States for the most part, because that's where most Canadians go to pay out of pocket. But because we don't have that system in our country, we have fewer resources to fight things like a pandemic. You look at the number of hospital beds we have per capita, the number of doctors and so forth. It's lower than in other nations. And so then a pandemic comes along and you see this huge strain on the healthcare system. Well, we have fewer resources to fight it in terms of, like I say, beds and bodies. So, I've been looking at this for a long time, and we've been spending money because this is an issue that's been going on for decades, where waiting lists have become a huge problem. Governments have spent more and more money every year, well above inflation. And I don't think we're really going to get to address the heart of the problem until we see structural reform, which would require several different things. It's not just simply allowing a private alternative for Canadians to choose, but looking at a whole bunch of other different measures. But I want to ask you, so you got back to Canada, and then, I alluded to this at the beginning, you did this sort of cheeky exercise, but there was a serious point there. You looked up the value of how much the government spends on the type of procedure that you had. You looked up how much you had paid, and then you had sent in an invoice to the government. Could you just tell us a little bit about that?
Well, I mean, it really is really a fairly simple equation. The government allocates a cost of $21,439 in Manitoba to a knee replacement, and mine cost $14,430. So I thought it reasonable, given that they had already budgeted it for me, if they just hadn't decided which fiscal year to put it in.
Yeah.
That to send them an invoice for fundamentally $7,000 less than it would have cost them had I had it done in Manitoba seemed a reasonable thing to do.
Mm-hmm.
But it wasn't just about me getting my expenses refunded, although that would be pleasant. It was really making the point that as a taxpayer of Manitoba and as a Manitoban, the government has a mission statement and the government has a mandate. Mm-hmm. And they are failing dismally on both of them. And part of their mission statement is to provide the medical facilities on a timely basis.
Mhm.
Well, they can do that if they simply reimburse people for going overseas, and they can't do that if they sit at home. So the idea of sending a bill and publicizing it was really not about me at all, but about the fact that I believe that every Manitoban should have that option. I think everybody in every province and territory should have an option to get healthcare when their provider is unable or unwilling to do it in a timely fashion. That was really the purpose of the invoice. I haven't, of course, heard a word from them. In 2 weeks, I got the rather anodyne, "Thank you for your correspondence. Teams of people are looking at it and will get back to you." But 2 weeks later, of course, nothing. So I think we'll be prompt them a little bit more.
Yeah, it's a big issue across the country. We actually got some data from Statistics Canada in 2019. It was 2017 data, and we asked the question, how many Canadians are going abroad, specifically for healthcare? Because Stats Can will do these travel surveys asking people when they leave the country, where are you going? What's the purpose, and so forth. And so at the time, there was an option to check off, well, I'm going for a medical reason. And we were able to calculate the number of, at that time, it was on the low end, it would have been at least 217,000 Canadians going abroad specifically for healthcare. It's not a small number. And when you start to think about all the money, that's a huge missed economic opportunity. There's an inconvenience factor for Canadians. There's an environmental factor. There's all these different consequences. Now, I think that you had mentioned in the CBC article that you were very satisfied with the care that you received over in Lithuania. Is that correct?
Oh, the clinic was absolutely first class.
No.
The surgeons were brilliant. The care was absolutely first class in every particular. It was, I mean, you wouldn't want to do it recreationally.
Yeah.
But it was a very good experience.
So if someone has two healthy knees, you wouldn't recommend they go over there for fun to go through the whole exercise.
The originals, yeah.
So the reason why I ask you is if you were able to receive that same quality of care, and I have every reason you would be able to, if there was a private clinic in Winnipeg, I assume your preference would have been to have stayed at home and gone through the procedure in Winnipeg. Is that
absolutely 100%? Yeah.
So I often think about this, just like I say, the missed opportunities that we have in Canada to build this sector out and take the pressure off of the public healthcare system. Because for everyone that is able to afford it and go abroad, there's probably some people that, maybe they just don't quite have enough. But if you don't have to pay for those travel costs, well, then maybe they're bumping into that category where instead of waiting for the public system, they're now suddenly outside of the public system, and everyone else can start bumping up in the public system, right? The waiting list gets shorter and it takes strain and pressure off of the public model. So you mentioned that you haven't received anything from the government. That's correct?
Right.
It'll be interesting to see how they respond. I'm going to ask you to follow up if you do hear anything back from them to let us know. But the one other point I wanted to just raise with you today is you had brought up in the CBC article on this, the Ireland model. Could you just tell us a little bit about your research about how Ireland addresses a similar situation? Because I wasn't aware that they did this.
Well, really fairly simply that they have a number of policies that effectively say that if we cannot perform the surgeries or the procedures that you need within a certain length of time, you are free to go to get, up to the cost that it would be in Ireland, the surgeries anywhere else within the European Union. Or at least you may be allowed to go outside, but the Irish people that I met at the facility were all under the impression that it was an EU benefit. And indeed, the English people who were at the clinic were all a little miffed because of Brexit. Now England is not part of the EU and they were not going to be reimbursed. So English were just like the Canadians. They were going there because they just simply didn't want to wait and get worse and spend 2 years in pain and economically inactive. It makes no sense for anybody.
Yeah, no, I certainly agree with you there. It doesn't seem to make a lot of sense that we have this ban. It's leading to a lot of unnecessary patient suffering. There's economic costs, there's environmental, there's social costs too. It puts a lot of strain on families, especially those who don't go abroad for such procedures, and then they're quite often imposing on family members to help them out if they get them less mobile, if they're having, in some cases people end up with mental health issues such as depression and that, because they're suddenly their life has changed as they go from an active mobile citizen to stuck in their apartment for a year, 2 years, or whatever. So there's certainly a lot of those costs, and I think ultimately governments need to be looking a little bit more at the big picture. And I'm really glad that you were able to take a few minutes to chat with us about your experience. Is there anything that you'd like to add that we haven't talked about?
No, I think the biggest issue that people seem to come back with, and it is an important one, is that, well, it's all right for the rich.
Mhm.
And I would like to make the point that, yes, I'm fortunate that I have the resources that I can do it.
Mhm.
But $15,000 is not the crown jewels. And there are an awful lot of people who spend an awful lot more than that on a snowmobile or a new truck.
Yeah.
If one had to borrow it, it's $600 a month for 2 years.
Yeah.
And once you get past the anger that you really have to, and you alluded to this earlier when you said, that we've paid taxes for years and we should not have to do this. And you think, you're right, you should not have to do it.
Mm-hmm.
But cutting off your nose to spite your face sometimes is not the best approach.
No,
And if you can rustle up the resources, you will earn back more than it costs in the 2 years you're going to save. And all in all, you can just get on with your life. It's as simple as that.
I agree, and I'm glad you raised that point, because that is the great fallacy, is that it's just the rich that are going abroad. And we have talked to a lot of middle-income people who, like you just explained, they've done that calculation. They realize that, hey, if I'm off work for a year or 2 years, here's how much money I'm going to lose. Can't afford that, so I'm going to have to spend a bit of money, take out a loan, whatever it is, get their health problem addressed so that they can continue to work and put food on their table and so forth. And we've also heard stories of family members, chipping in and helping a family member in need to go abroad for healthcare. It's unfortunate, but I am glad that you mentioned that point, because it's a great fallacy that it's simply the wealthy that are going abroad. It's a lot of everyday people that are struggling with the status quo. So again,
life's back on track. It's
oh, exactly.
that it's a reality, and the option is there. And Lithuania is great.
Well, that's good to know, that for any viewers, if they have any needs, that they can consider going to Lithuania. And I know they've got a champion on their side. That clinic has a champion, as you're certainly a happy customer. Again, thank you for taking a few minutes to chat, and appreciate your time today.
No, it's a pleasure. Thanks.
Take care.